Hello everyone, it's Dr. Michael Sistare again. Thank you so much for tuning in. Today I'm going to talk to you a little bit about a procedure called the neck lift. Like I mentioned in another video, the face is generally divided up into three areas with three particular procedures addressing each area. There's a brow lift, which addresses above the eyes, a face lift, which addresses between the eyes and the jawline, and then a neck lift, which addresses between the jawline and the clavicles, the collarbone, so the area of the tissue surrounding the neck. Today I'm going to talk to you a little bit about the neck lift. So generally people come to me asking about a neck lift for one very obvious reason, and that's that they have this chicken waddle in front, that they say they've lost the definition of the skin in front of their neck and the skin looks like it's hanging down. It happens to everybody if given enough time. That's what skin does over a long period of time, is it sags. There's a few different reasons why it would sag. The two main common reasons are sagging of the skin itself and then sagging of the muscle underneath, the platysma, which is the muscle that you see if you kind of clench your neck like this. You see all these strands in your neck. That's called the platysma. So as the skin sags, as the platysma sags, you lose definition of this right angle that you have on the junction between your chin and your neck. So that's the issue that a neck lift addresses. How do we address this? Well, normally we make two sets of incisions. The first is a little horizontal incision right here, right underneath your chin, that's barely seen by anybody. And from that incision, we can buttress the platysma back together and lift it up and piece it together from one side to the other, and kind of gives your neck support by sewing the edges of that muscle together. Additionally, we can remove excess fat that exists on top of the platysma but underneath the skin. But then that leaves us with the excess skin. We can't get rid of the excess skin through this incision, so more often than not, it's combined with incisions that start right behind your ear and then travel upward to where your hairline starts, and then it swoops back downward behind your hairline so it's barely perceptible. Through this incision, we can tighten the tissues of the neck back like this, we can remove any excess skin, and we can also get to the platysma from another angle that allows us to kind of support the platysma and give your neck support and the bottom of your jaw support to reestablish that right angle that you used to have when you were younger that eventually goes away with everybody. So what are the scars? The scars are just like the incisions. You have a little bit of a horizontal scar right underneath your chin that you can't see. It's behind where your chin juts forward below your lips. And the incisions behind your ear are placed there because they're very well hidden. Most women who undergo this procedure, the scar is very easily hidden by the hair that they have. Even if you're a guy and have short hair like me, you can't see the scar because it's hidden by your ear, and we drop the scar in front of your hairline down your neck so that you couldn't see it once the scar is healed, even if you look for it. What's the recovery like? So when you wake up from surgery, your neck will be swollen as a result of the tumescent fluid that we injected during the procedure. That swelling goes away in the first 24 hours or so after surgery, 80 to 90% of it anyway. In the week or two following surgery, it's not uncommon to have a little bit of tenderness, a little bit of bruising, and a little bit of residual swelling that does go away pretty quickly after surgery. It's not uncommon to have a layer of swelling right here at the bottom of your neck. Since gravity pulls everything downward, it's not uncommon that the swelling that you have falls to the bottom of your neck and it eventually goes away. You will not have this for very long. The scars, like I said, are very well hidden. The recovery is very tolerated. It's not an especially uncomfortable procedure. You wake up with a face wrap that we ask you to keep on until the following morning when I see you in my office. And the results immediately after surgery are phenomenal. This is one of the procedures that you don't necessarily need to wait for a few weeks for the tissues to fall back into a natural position. This is a procedure where you wake up the next morning after surgery and you look at yourself in the mirror and you can see the definition and the angle that's restored to your jawline. That's why this is one of my favorite procedures, because the before and the after pics, even 24 hours, the 24-hour difference between before surgery and after surgery are miraculous. And people love when I take off their wraps the next morning in the office and they can see the definition that they now have. The tissues of your neck are going to be tight to begin with. We do that on purpose in anticipation of the sagging that's going to come in the few weeks following surgery. But 2 weeks to a month after surgery, everything is nice and natural looking. It's not overly tight. The skin has acquired an appropriate amount of laxity, and everything is youthful, natural, subtle, but obviously aesthetic. So that addresses a neck lift in a nutshell. Thank you so much for watching. If you have any questions, please post in the comments below and I can address your questions individually. Otherwise, the practice is Palm Beach Cosmetic Surgery. Come and see me and I can discuss with you what exactly we can do to meet your aesthetic needs. Thank you so much.